Now we are gradually going to begin to discuss recovery. As we saw parallels between addiction for the person with the disease and the family system, we're also going to start talking about how recovery principles also apply not only to the individual with addiction, but also to the family system as well. So the parallels don't cease. We're actually going to build off those parallels at this point in time. The first principle to introduce is detachment. We know that somebody in active addiction cannot detach from their compulsion to use, that they have to use, they have to do what they need to do right now in order to satisfy that craving. For them, it's as simple as survival, such as eating or sleeping or any of the drives we have that maintain our survival. Somebody with addiction must use in order to survive. One of the components and principles we begin to teach folks in early recovery is how to detach from that compulsion to use. That oftentimes means building a pause into the reactive nature of addiction and to the reactive behaviors of the person with addiction. How can we start to build a pause for that individual so that they don't use just because they feel like using? How we begin to do that is we introduce coping skills. Some of those coping skills may be talking to a sponsor, talking to a peer about what you're feeling, writing about what you're feeling, reconnecting with old ways of coping. There are multiple ways to begin to allow recovery to grow for somebody, so that for a patient, so they can begin to detach from that compulsivity to use. Likewise, with family systems, how do family systems begin to detach from the behaviors of the person with addiction? We would say that the parallel there for recovery would be also reaching outside the addicted system, talking to folks who have been through it before, such as in an Al-Anon meeting, or reading some text, getting some literature, having a family program education with the counselor or with the Farley Center to begin to discuss what are those things that are making it difficult to detach, and developing a plan around that so that that healing, that detachment, and that early recovery can begin to develop. In essence, it's a way of becoming non-reactive and allowing the thinking part and the reasoning part of the brain and the system to begin to take over the decision making versus the reactive tendencies that have led the system and the individual to this point. At this point, there is a need for a change. As we continue further talking about the family in recovery, what are we talking about exactly? What is the family recovering from? The family is recovering from some of the similar things we've discussed before in parallel with the person with addiction. Preoccupation, efforts to control, tolerance, denied or minimized feelings, compromised values, protecting the other, accommodating lifestyles, and taking on the other's responsibilities. All of these things prioritize the behavior and needs of others ahead of our own. One thing we drive home here at the Farley Center to the individuals with addiction is if they cannot prioritize their own recovery, then it's possible that they are going to lose many other things. So the one thing is to begin to care for self, begin to take care of themselves, begin to learn to cope, how they need to cope, so that they don't lose more than what they've already lost. Well, we are proposing that for the families as well, addicted family systems, that they additionally begin to prioritize their own needs, take care of self in order to be able to help others. Additionally, another aspect to recovery for the family is you didn't cause the addiction, you can't control the addiction, and you can't cure the addiction. And they ultimately cannot make them do anything. That may sound difficult to hear for some folks, and we understand that here, but it also is the way to recovery. In order for somebody to maintain the recovery, they must first understand that it is their responsibility to ask for help and get the help that they need to get. Additionally, for family members of folks with addiction, it may be important for them to understand that addiction is a chronic and progressive disease. Additionally, recovery is progressive as well, and we will be discussing the recovery model here for the next few minutes. When we talk about recovery, there are three main stages we're talking about. We're discussing transitional stage, early recovery stage, and ongoing recovery. In transition, a patient, for example, at Farley in treatment, goes from drinking to abstinence, and we help with that from a medical perspective and also from a therapeutic perspective. We use what's called an interdisciplinary approach to support the individual's ongoing recovery and abstinence. In early recovery, abstinence gains momentum. A lot of learning and a lot of change occurs. In ongoing recovery, abstinence is now normal. Massive changes have been processed, and the family is guided by recovery principles such as the individual is. It's important to remember, both for the individual and for the family system, that recovery is a gradual process, and it is a process of gradual change that requires patience and responsiveness to different situations in a deliberate manner versus a reactive one. Recovery is a journey from the starting point of abstinence to reconnection to self, others, and a spiritual source. What we begin to see now is as recovery takes hold for both the individual and for the family members, those interests start to come back online again. Life begins to get better. It's not perhaps what the old normal was, but it's what we will call a new normal begins to evolve. The transition stage requires focus on self, reaching outside the family, and detachment. These are things that have been evidenced by the research, and we continue to be able to help both family members and individuals through this model.